Do you sometimes feel like a child or teen you know often gets into fights, lies, or breaks rules, even after being told not to? Maybe they've hurt animals, bullied others, or broken into someone's house just for fun. These aren't just bad behavior. They might be signs of a serious condition called conduct disorder. It's more than rebellion. It's when a young person repeatedly ignores the rights and feelings of others. Think of it like a broken empathy switch. They know what's right, but don't care to follow it. Does this sound familiar in someone you know? What turns a child's empathy switch off? It's never just one thing, it's like a puzzle. Some kids are born with a sensitive brain that overreacts to stress. Maybe they got it from their parents. Others grow up in homes full of anger, abuse, or neglect. Imagine growing up where yelling is normal. You might learn to hit before you talk. Also, watching violent TV, playing aggressive video games, or having friends who break rules can train the brain to see bad behavior as normal. Even brain injuries or living in high-crime areas can add fuel to the fire. Could the child's environment be shaping their choices? How do you know if a child might have conduct disorder? Look for patterns. Are they often aggressive, like bullying, fighting, or using weapons? Do they hurt animals just for fun? Maybe they lie, steal, skip school, or break into homes. They might blame others for their mistakes or show no guilt at all. For example, a 12-year-old sets fire to a trash can and laughs about it. Or a teenager steals from a sibling and says, "They had it coming." These aren't one-time mistakes. They happen again and again. If a child seems to lack guilt or respect for rules, should we take it seriously? Doctors don't use blood tests for conduct disorder. Instead, they talk with the child parents' teachers and even friends. They ask how often do outbursts happen, when did they start, are school reports full of discipline issues? A mental health expert uses a checklist from the DSM-5, a guide for mental health to decide. Treatment isn't a quick fix, but it helps. Therapy like cognitive behavioral therapy, CBT, teaches kids to stop and think before acting like a mental pause button. Parents learn better ways to set rules and give consequences. In some cases, if there's also ADHD or depression, medicine might help. Family therapy fixes broken communication. Can better thinking and support change behavior over time? The best time to stop conduct disorder is before it starts. Think of it like planting a good tree. Early care matters. Parents who set clear rules, give love, and stay involved help kids grow healthy minds. Schools with programs that teach kids how to handle anger or solve problems are also key. For example, a school teaches students to say "I feel upset" instead of hitting. Communities can offer after-school clubs so teens don't get pulled into bad groups. If a child shows early signs, like being cruel to pets, stepping in fast with counseling can make a big difference. Can love, structure, and early help guide a child back on track? Scientists are learning more every day. One big advance is that brain scans show kids with conduct disorder often have less activity in brain areas linked to empathy and self-control, like the prefrontal cortex. This isn't their fault, it's biology. Now, researchers are testing better therapy methods, like ones that train kids to read emotions in faces. Also, new programs help parents online, making support easier to get. Some studies show that omega-3 supplements might reduce aggression in teens. It's early, but hope is growing. Could understanding the brain help us heal behavior in new ways?